Androgen insensitivity syndrome is a genetic disorder in which a person with an XY genotype, genetically a male, is insensitive or doesn't respond to androgens, which are the male sex hormones. Androgens are responsible for primary sex characteristics, like development of a penis and testes, as well as secondary sex characteristics like height and body shape. So in androgen insensitivity syndrome, all of these can be affected. Alright, so normally, very early on in fetal life, male and female genital tissues are undifferentiated and look identical. During the 7th or 8th week, the fetal gonads develop either into testes or ovaries. In males, a gene on the Y chromosome called the sex-determining region Y gene, or SRY gene for short, helps the fetal gonads turn into the testes. By the end of week 8, the testes start producing androgens, the main one being testosterone. A small fraction of testosterone gets converted by the enzyme 5-alpha reductase into its more potent form, called dihydrotestosterone, which is mostly responsible for development of male external genitalia. Looking closely at these structures, at the top there's the genital tubercle, which is a small projection. Just below that there's the urethral groove, which is the external opening of the urogenital sinus, or the future urethra and bladder, and this is surrounded by the urethral folds and the labioscrotal swellings. Now, once dihydrotestosterone reaches the undifferentiated external genital structures, it makes the genital tubercle elongate into the phallus, that eventually becomes part of the penis. The elongating genital tubercle pulls up the urethral folds which fuse in the midline, forming the spongy or penile urethra. Only the tips of these folds remain unfused, to form the external urethral opening at the distal part of the penis. The labioscrotal swellings also grow toward each other and fuse medially to form the scrotum, which is the sac skin that contains the testes. Internally, the urogenital sinus is connected to a set of ducts, called Wolffian and Mullerian ducts. Testosterone also causes the Wolffian ducts to differentiate into the epididymis, vas deferens, and seminal vesicles. At the same time, the testes also produce a hormone called the anti-Mullerian hormone, which prevents the Mullerian ducts from developing into the female reproductive tract and instead makes them degenerate. About 2 months before birth, testosterone helps the testes descend from the abdomen into the future scrotum, and later on in puberty, testosterone helps sperm cells mature, a process called spermatogenesis. In females, there's no Y chromosome, so the SRY gene is absent. As a result, ovaries develop from the internal gonads, and androgen levels remain relatively low, so the genital tubercle remains small. And this forms the clitoris, and the urethral folds and labioscrotal swellings remain unfused or separate, forming inner and outer skin folds that surround the opening of the vagina, and these are called the labia minora and labia majora. Without the testes, anti-Mullerian hormone is also absent, so Mullerian ducts develop into the fallopian tubes, uterus, and upper part of the vagina. In androgen insensitivity syndrome, XY individuals have testes that produce androgens, but these hormones can't exert their action, because there's a defect in the androgen receptor on various target tissues like the external genitalia, genital ducts, and the testes itself. Androgen insensitivity can be complete, partial, or mild, depending on how well the androgen receptor is able to bind androgens. In complete androgen insensitivity, the receptor is totally non-functional, so the cells don't respond to androgens at all. As a result, the testes try to respond by increasing androgen synthesis. Without the effects of androgens, the testes sometimes don't descend into the scrotum, and instead remain in the abdomen or pelvis, which is called cryptorchidism. Cryptorchidism is related to a higher chance of developing testicular cancer later in life. In the absence of androgen influence, the epididymis, vas deferens, and seminal vesicles don't develop normally, and spermatogenesis is also affected, so sperm don't mature. Additionally, the absence of androgen influence means the external genitalia don't masculinize, and therefore they take on a female form, with a normal-looking clitoris, labia, and vaginal opening. In puberty, the excess testosterone is converted into estrogen, which is the primary female sex hormone, and this causes the development of normal female secondary sex characteristics, like breast growth, widening of the hips, and female fat distribution. Even though androgen influence is missing, the testes still produce anti-Mullerian hormone, and that means that these individuals don't have a uterus or fallopian tubes, and that their vagina ends in a blind pouch. So these individuals look like females, but they don't have menstrual cycles. In partial androgen insensitivity, there's some remaining function of the androgen receptor, so the cells and tissues are partially sensitive to the androgen effects. As a result, the appearance of the external genitalia and secondary sex characteristics varies widely, usually with a mix of masculine and feminine features. Finally, in mild androgen insensitivity, there's masculinization of external genitalia, but there may be some female secondary sex characteristics. In all three types of androgen insensitivity syndrome, individuals are usually infertile, since their testes can't produce mature sperm, and they have no ovaries or uterus. The androgen receptor gene is on the X chromosome, and androgen insensitivity syndrome is inherited in an X-linked recessive pattern. So in males, a single mutant gene causes the condition, and they can pass on the mutant gene to their daughters. Females with a single mutant gene are carriers, and they can pass the mutation to both their sons and their daughters. Androgen insensitivity syndrome can be diagnosed in infants with cryptorchidism. Alternatively, it can also remain undiagnosed until puberty, when an individual that has female genitalia doesn't start menstruation. A karyotype can be done to visualize the sex chromosomes to ensure that the individual is genetically male. In addition, serum testosterone and dihydrotestosterone levels are typically high. An ultrasound scan can be done to confirm the absence of the uterus and ovaries, or to locate the testes in the case of cryptorchidism. Treatment typically involves surgical removal of the testes, especially in the case of cryptorchidism, to help reduce the risk for cancer. Some individuals with androgen insensitivity syndrome adopt a female gender identity, whereas others adopt a male gender identity. Those that adopt a female gender identity can use estrogen supplements to help them develop a more feminized body. Those that adopt a male gender identity can use testosterone or dihydrotestosterone supplements, as well as surgery for external genitalia to help them develop a more masculinized body. Alright, as a quick recap, androgen insensitivity syndrome happens in XY individuals and is caused by a loss of function of the androgen receptor, which could be complete, partial, or mild, and affect the development of primary and secondary sex characteristics.